Cape Borough NHS. This is an organisation, it's a local organisation affiliated to the national Cape Borough NHS public that's really quite simply set up to maintain a nationalised health service, a full, comprehensive, free at the point of delivery health service. The health service that was put in place in 1948, 66 years ago. Also in East London, we've had to deal with the problem of PFI debt. The London Hospital was built through a private scheme, and £2 million a week goes out to pay for that. So we've campaigned against threats to our A&E, and we've campaigned against downgrading of nurses and the reduction in staffing levels and the bullying culture at Bart's Health. And we've campaigned for reinstatement of staff members like Charlotte Monroe, who was sacked for speaking out. And we've campaigned against the centralisation of cancer services to central London.
I also have a message of support from our clinical commissioning group. It's rather a long statement of their policy, but I think just the main thing to take from this is that our clinical commissioning group, which is the body responsible for health services in our area, has recognised the problem, the attack on GP services, recognised this as a very serious issue for Newham, as well as for the other boroughs, Tower Hamlets and Hackney, that we're working with. But of course it is a problem across the country.
When Jubilee Street practice stood up and said we're not taking this, what we found was there were other practices in Tower Hamlets. There are 12 really badly affected practices in Hackney, and in another 5 badly affected in Newham. However, all of the practices in the country are affected by funding cuts one way or another. And if they're not really bad this year, then they will be really bad by next year. GPs have experienced something like a 40% increase in their work over the last few years, and meanwhile the government has been pushing back and pushing back and pushing back on the income that the practices have been getting.
Over the past 18 months I've been in 3 different GPP practices, I've been in 4 different hospitals, I've spoken to hundreds of workers within the NHS, and the message that I'm getting from all of them is of constant pressure to do more, pressure to work faster, pressure to do things cheaper, and that pressure builds and builds and builds, and you end up with demoralised healthcare workers and patients that don't trust the motivations of their doctors. They don't trust that they want them to do the best for them because of the pressure that they're under.
It is very depressing now to hear that 2 teachers in every 5 leave teaching in 5 years. So they have spent at least 3-4 years training, and they get there and they realise the job is impossible. It shouldn't be an impossible job, but what they're finding now, they're doing 60+ hours a week, their pay is uncertain, their pensions have been cut, and it is becoming, as I say, an impossible job. I think now we have to get together and join things together, join different campaigns together and support each other so that we get somewhere. Thank you.
But I must say the NHS is crumbling down. We have to do something. I need the support from all of the people of the nation, not only one Newham, not only one new Stratford city. We need the support from whole country here. Otherwise, this NHS will crumble down to ashes. The GPs are the backbone of the country. So you must understand all these things, and you should raise questions to the MPs, councillors, and the government, ministers, and everybody. Thank you very much for my just humble request. Thank you. Bye.
I think one of the really important things, and that's relevant to the campaign of the GPs, is to understand who is it who cares about, delivers, builds, has the vision, has the knowledge of our health needs, and what health services and health professionals can give to improve the health of the local population. It is the people, it is the staff, it is the doctors, it's the GPs, it's the community nurses, it's the hospital doctors, it's the hospital nursing staff, it's the therapists. But we, the staff, are the ones that are under threat. And as I understand it, a threat to the GP practices is one thing that could happen is that family doctors could be taken over by multinationals and they just employ people to come in, go out, and there's no stability, continuity for the care of the families and the patients and the people who know them. Now, this fact that health staff and the people who will stand and defend health services are under such attack is something that I think it's very important to resist. Now, this is an assault on our rights to organise, our rights to speak out. And what's really important, I think, is that we, the health professionals and workers and the community, take a stand and say, no, this is our NHS. This direction which we're being driven is not acceptable.
As everybody here knows, Charlotte was unjustly sacked and she has a tribunal case, which means it depends on British law, which is a big chance to take. But Charlotte deserves to be reinstated and should be reinstated, and I think all of us here would fully support Charlotte in her struggle for reinstatement. And of course it's the issue: are you allowed to tell your members, if you're a shop steward, what's going on? Are you allowed to tell the general public what's going on? And I think there's no one here would disagree that we should all know what's going on. And in fact, if we knew more of what's going on, there would be a big change, I do believe.
And one thing about the GP surgeries is means that if there's going to be less GPs, we're going to have more people in the hospitals, and so there's a knock-on effect. And at the moment, the hospitals in East London are overstretched, the nurses are overworked, there's not enough staff, there's not enough people to run them. And this is one reason this has happened is because when we took over the London hospital, we merged with Barts Health, and they're using Whips Cross workers and Newham workers to pay for their crisis, to pay for their massive debt of 123 million a year ongoing for 22 years they've got to pay back.
I find myself really angry with the health secretary reducing funding and trying to get rid of our doctor's surgery, not only in Newham, right across the country. And I must fight the government with all our energy, with our body and soul. I wish I could say more. I haven't got much time. Thank you very much. Support us and we will deliver.
Rod Finlayson, who spoke a short while ago, referred to the Commonwealth Report. And I think it's important that people familiarise themselves with the Commonwealth Report. This is not Her Majesty's Commonwealth, but this is a think tank in America that ranked all the healthcare systems in the Western industrial countries, about 10 of them. And what they found was that on 8 different measures, the UK's National Health Service topped the world.
In 1948, one of our nation's greatest social achievements was set in motion. Healthcare, instead of being restricted to those that could afford it, became the universal right of everyone. Young, old, rich and poor could turn with confidence to the newly formed National Health Service. Since then, the NHS has moved to meet the social, political and economic demands of the times. But it's always remained the NHS, our NHS, a place our parents, our children, our grandchildren can turn to when in need. But now the government is implementing the biggest shake-up in its history, right under our noses. Could you have ever imagined that the NHS would be privatised? The government won't say it, but that's what's happening right now. By 2014, NHS hospitals will become foundation trusts, making them more like private businesses. They will be able to raise even more money from treating a greater number of paying patients, pushing the rest of us to the back of an ever-growing queue. NHS staff are being forced into the private sector, with their wages and pensions driven down to help sell them on. These are people who joined the NHS because they care about people, now working for private companies who care about profits. Money that should be spent on patient care will instead be lining the back pockets of some corporate millionaires. This will be the new privatised NHS. But why? Before this government came to power, the NHS had the highest approval rating in its history. Not now. 1 in 10 of GP surgeries are now run by private companies. £20 billion of our NHS money will be handed over to companies like Boots, Serco, Virgin Care and Circle. The nurses, paramedics, midwives, health visitors and cleaners that care for us are being hit with cuts to pay and pensions. With morale at an all-time low, patient care will start to suffer. 20 billion of cuts, 7,000 fewer nurses, longer waiting times in wards and A&E, queues and patients suffering. Is this really the NHS we want? The NHS has helped us for generations, but now it needs your help. When you are sick, you need the NHS. Now it needs you. Make sure you play your part. And together, let's save our NHS.